Welcome to today's webinar, Gastrointestinal Health of People with Down Syndrome from a Primary Care Perspective. My name is Laura Crone, and I'm the Project Manager for Research and Education at the Advocate Medical Group Adult Down Syndrome Center in Park Ridge, which is a suburb of Chicago in Illinois. Next slide, please. And one more, please. We are a healthcare clinic for adolescents and adults with Down syndrome ages 12 and older. Since opening in 1992, our healthcare professionals have seen over 6,000 individuals with Down syndrome. In addition to providing patient care, we offer a variety of research and education opportunities, such as this webinar and our online resource library. Next slide, please. Our online library has over 500 articles, visuals, videos, and other resources related to health and well-being of individuals with Down syndrome. You can access it free of charge at the link on the slide, and I will also put it in the chat. Next slide, please. Before I introduce Dr. Chicoine, I have a few reminders. The webinar is being recorded, and the link to the recording and the slides from the webinar will be emailed to attendees within 1 week. We will also post it in our resource library and on our Facebook and Instagram pages. There will be a Q&A at the end of the presentation. Please feel welcome to submit questions throughout the webinar using the Q&A option. We will address as many of the questions as we can at the end. Next slide, please. Please note that this webinar is intended for educational purposes only. It is not supposed to take the place of an evaluation or an appointment with a healthcare professional. Next slide, please. Our presenter today is Dr. Brian Chicoine. Brian Chicoine is the co-founder and medical director of the Advocate Medical Group Adult Down Syndrome Center here in Park Ridge. He is on the faculty of the Family Medicine Residency at Advocate Lutheran General Hospital. He received his medical degree from Loyola University of Chicago Stritch School of Medicine and completed his family medicine residency at Lutheran General Hospital. Dr. Chicoine has provided medical care for adults with intellectual disabilities for over 35 years and has presented and written extensively on caring for adults with Down syndrome. Thank you for being here. And with that, I'm going to turn it over to Dr. Chicoine.
Thank you very much, Laura, and welcome to everybody. What a pleasure to be here with you all today. We are going to be talking about gastrointestinal conditions in people with Down syndrome. And if you saw in the title that it's from a primary care perspective, as Laura introduced me, I am a family physician by training. I'm not a gastroenterologist, so there may be some topics we don't touch base on that you were hoping to hear, and I hope not too many of them. And there may be some questions that am not able to answer since I'm not a gastroenterologist. But I will try to really share the information that we've gathered over many years of treating individuals with Down syndrome, participating in their health journeys. And I should also say that certainly these are gastrointestinal, as you'll hear as we go through these talks, that the gastrointestinal issues are common in people with Down syndrome. And certainly that was evidenced by the number of people that signed up for this webinar, that there's obviously an interest and a need to learn more about this together. So we will jump right on board. So there are a number of conditions and a number of issues that we really do want to address. And so that's how we ended up breaking this down into two parts, just because it really felt like there was more information than we really could manage in one webinar. So today we're going to do this introduction, and then we're going to spend some time talking about the differences in the gastrointestinal tract of people with Down syndrome compared to people without Down syndrome. And then we're going to talk a little bit about how to optimize GI health. What can we do day to day that really will improve the GI health and really the total body health, since the GI tract is so impactful on the rest of the body. And I think that's a real important point. We really want to spend some time addressing that. And then we're going to talk a little bit about some common GI symptoms and a little bit about GI testing. And that'll really set us up to have the next presentation in a couple of weeks, where we're really going to kind of, in a sense, take a trip through the GI tract and really sort of from stem to stern, from top to bottom, really look at the different conditions that can occur throughout the gastrointestinal tract, and particularly focus on the ones that are more common in people with Down syndrome. So without further ado, we're going to jump in. And so we're going to start with, and there will be time for questions at the end, as well, as I think Laura mentioned, and putting those in the chat would be great. We're going to start with focusing on the differences in the gastrointestinal system of people with Down syndrome. Why are there such common GI issues, and where does that stem from? And so this is obviously just a picture of the gastrointestinal tract, starting with the mouth all the way down to the anus and everything in between. And we're going to really take a look at some of those differences in those different areas. So the gastrointestinal system of people with Down syndrome, there are several differences, and they really do lend themselves to needing some particular attention in when looking at the GI health, and also being aware when looking at GI complications. And those include differences in the skeletal muscle and the somatic nervous system, differences in the smooth muscle and the autonomic nervous system, and in the innervation, the way the nerves interact with the tissue, the organs in the gastrointestinal tract. Differences in the connective tissue, the tissue that holds us together. Differences in the cell function, and then differences in the flora, which is the bacteria that's in our guts. So let's start with the skeletal muscle and the somatic nervous system. So these are the muscles that are voluntary, and the things like I want to move my arm, and I think about that, and then the skeletal muscle, the muscles in my arms react to my thinking and to the nervous system signals that tell the arm to move. And similarly, there are some skeletal muscles that are involved in the gastrointestinal tract. They're not in the abdomen, but they're outside. So our muscles in our abdominal wall, for example, we might use them if we need to have a bowel movement and we're straining a little bit. Those would become, our brain would tell those muscles to fire to help with to pass the bowel movement. So those are voluntary muscles, and those are voluntary. That part of the nervous system is voluntary in the sense that our brain sends signals to those muscles and tells them to do their work. And we know in folks with Down syndrome that in general there's lower tone of these skeletal muscles, and there's also the innervation is such that the muscles have lower tone. So, and this may be an issue with, for example, with mouth chewing. And so with the mouth, with chewing, sorry. And so again, if there's differences in that, and the muscles are not having the same normal tone, that could impact chewing. And certainly we've seen that that's an issue commonly in folks with Down syndrome. And similarly, as I mentioned with constipation, with the core muscles, where somebody needing to increase the abdominal pressure to impact having a bowel movement, that may be reduced, and so that may make overcoming constipation more challenging, which we know is a common symptom as well. So that's one part where the system is different in people with Down syndrome, and then even more so is the smooth muscle and the autonomic nervous system. So smooth muscles are muscles that essentially align our organs. So there are smooth muscles in the lungs, there are smooth muscles in the blood vessels, and there certainly are smooth muscles in the gastrointestinal system. So, and those are typically innervated by the autonomic nervous system, the part of the nervous system we don't have to think about to function, and it controls things that really happen without us really having to spend time contemplating. So that would be things like heart rate and blood pressure and sweating, but certainly also gastrointestinal function. And so those are all part of the have smooth muscle and autonomic nervous system function. So that again, the autonomic nervous system and the smooth muscles are also different in people with Down syndrome. So there is a difference in the function of the autonomic nervous system. And there's also the smooth muscles, also just like the skeletal muscles, tend to have lower tone. And that certainly can contribute to things like constipation. So again, these differences are keys to understanding some of the health conditions we see in people with Down syndrome, but also become evident in a few minutes here when we talk about optimizing GI health. And then the innervation, the nerves interaction with the tissues is also different. So we know we're going to talk next time about achalasia, which is a condition in the esophagus, the tube between the mouth and the stomach, um, that where the food does not move through the esophagus appropriately, and that's called achalasia. And there is it is now known that there is an autoimmune condition in which the nerve cells in the esophagus can be damaged by the immune system actually damaging those nerve cells. And so our own immune system attacks ourself in a sense. That's what autoimmune means. And we know that autoimmune conditions are more common in people with Down syndrome. So this seems to be one more place where there may be an autoimmune impact on people with Down syndrome. And then it's also a study done, it hasn't been replicated in humans that I'm aware of, but a study done, there are what are called mice models for Down syndrome, where the mice have an extra chromosome, and they have some of the same physical and health characteristics of people with Down syndrome. And there's a mouse model that has been demonstrated to show a decreased number of nerve cells in the colon of these mice that in effect have Down syndrome in a sense. And so that would be that there is less signal to going to the colon. And that again, also, if they're not getting those signals and and the smooth muscles then are not contracting as well, that could also contribute to things like constipation. So there are a number of smooth muscle and autonomic nervous system issues in people with Down syndrome that probably impact their GI health. The other thing that we know is different in folks with Down syndrome is connective tissue. And that's typically on the basis of a difference in collagen, which is part of and this is the tissue that sort of holds us together. And this is collagen is part of that. And it's so what connects us, what connects different parts of the body. And so if that is different, and it has been shown to be different in people with Down syndrome, so there's decreased strength of the connective tissue. And we certainly know that from things like loose joints, atlantoaxial instability. More people with Down syndrome have difficulty with, the kneecap becoming subluxed or, becoming malaligned, joints that are looser, but it's also true in the gastrointestinal system. And so with a less strength of the connective tissue. Again, we'll go back to constipation for a second, but so if the connective tissue is not as strong as we do know that it's in Down syndrome, or not, doesn't hold the same level of strength, that can get stretched out more easily. And again, you could kind of see how that would contribute to constipation if the stool is building up in the colon and it's just stretching, where in someone else it might contract more at that point. You can see where that can be more of a problem. So again, so this is another difference that where the connective tissue, where the differences in the gastrointestinal tract impacts GI health. And then cell function can also be an issue in some folks with Down syndrome. So the gastrointestinal tract has lots of different types of cells. Some of them are secretory, but their job is to secrete different hormones or different enzymes or whatever the case may be to participate in digestion and absorption of foods, et cetera, and vitamins. And we know that there are cells within the stomach called the parietal cells, whose one of their jobs is to secrete something called intrinsic factor. An intrinsic factor binds with vitamin B12 that in the food and drink we're consuming, and then it binds the B12, and that combination of the intrinsic factor and the B12 then goes to the small intestine, and it's able to be absorbed. And if you don't have intrinsic factor, you cannot absorb B12 as well as when you do have it. And again, unfortunately, one of the things that we see in folks with Down syndrome, I mentioned the autoimmune conditions and being more common. And one of the things that happens to some individuals, and probably happens more common in people with Down syndrome, is that the immune system attacks these parietal cells and reduces the amount of intrinsic factor that is secreted into the gastrointestinal, into the stomach, and then into the and part of the absorption process. So if there's reduced intrinsic factor, being secreted, then there's the chance that the B12 will not be absorbed as well, and you could potentially have a B12 deficiency. And then absorption is a job of also a job of some of the cells in the gastrointestinal tract, particularly those that line the gastrointestinal tract. And absorption, breaking down different food substances into small pieces and then various tiny pieces, and then these cells absorb those pieces in vitamins, minerals, calories, etc. And so if the cells become damaged, then there will be reduced absorption. And we'll talk about celiac disease next time, but the celiac disease is, as you probably are aware, is significantly more common in people with Down syndrome. And what happens with celiac disease is that the cells in the small intestine that line the small intestine, you can see these finger-like projections that are demonstrated in the picture there. Those get damaged. Those are called villi, and those get damaged. And actually, if you look at the picture of a microscopic picture of a small intestine, it's flat in someone with celiac disease. So all those little projections have been, not all, but many of those have been damaged. And with that damage comes a reduced ability to absorb foods and vitamins, et cetera. So again, this is one other place that we see vitamin B12 deficiency more commonly in people with Down syndrome, would be when the cells are not able to absorb the vitamins and minerals, et cetera, in the same normal fashion. And then thirdly, not really part of the GI function, if you will, not really considered part of the GI function, but considered more the endocrine function. There are some cells that sort of fit in the gastrointestinal organs that have endocrine function that can also become abnormal, and particularly regarding what are called the beta cells in the pancreas. And beta cells produce insulin. And again, although they're really not considered part of the GI tract per se, these cells are in the pancreas, and if those become damaged, then people will have reduced insulin, and then will commonly, in that situation, develop type 1 diabetes. And again, that seems to be autoimmune once again. So you'll hear that as a recurrent theme, that autoimmune conditions do have a significant impact on people with Down syndrome as they are more common. So there's a number of different cell functions that can be impacted in people with Down syndrome. And then lastly, what I think we're really learning more and more about it. It's just such a fascinating topic. And again, a lot of study is going on. It's so fascinating. What often is called the gut-brain connection. And what that is that the GI system is full of bacteria, and hopefully it's full of healthy or good bacteria, so to speak. And so bacteria has a lot of functions in our GI tract. It helps us absorb food, helps us absorb vitamins and minerals, helps break down foods into usable parts, et cetera. So lots of important things with regards to the gut-brain connection. And so certainly it affects digestion. It actually, having a healthy flora affects immune function. Certainly there's more data coming out that it can affect mental health if the GI flora gets altered. Certainly it can affect dental health for those who the GI flora gets altered in their mouth. And it seems to also, again, when altered, it can contribute to inflammation. And we do know that inflammation is a problem in many people with Down syndrome. It can contribute to a lot of different health issues. There's even some data now suggesting that it may be related to aging or even more rapid aging. So really a lot of good information. We're going to talk a lot about health promotion here of the GI tract in just a moment. And certainly considering the issues of the GI flora is very important when we talk about that. So I will just jump in with a case here, thinking of all what we just talked about. Joe, again, these are not any one individual. These are sort of a collaboration of multiple people, and so there's no violation of privacy or anything because this is not really one individual. But so we'll just call him Joe, as a 24-year-old man with Down syndrome, and he has a long history of constipation. At previous appointments, we discussed diet and hydration and exercise, which we'll talk about here in a second, as possible beneficial factors to help with this constipation. But he's had difficulty changing his habits. That's true for many of us. The doctor gives us recommendations on lifestyle changes, and we may do our best and fall short of where we'd want to be, and we continue to have the problem. And this was the case with Joe. So Joe was periodically taking Metamucil, which had helped. But he came back for his next appointment and he said, I really just don't quite feel quite right. And I'm still not well, and I still have this constipation issue. And I'd really like to go back and really talk about, what are those things you talked about that are not medications that really might benefit my overall health, but particularly my GI health. And so what would we talk about with Joe? And we would talk about this optimizing GI health. And so there's a number of considerations, really. So again, we talked about people with Down syndrome having more inflammation, and again, so how can we reduce that inflammation? Are there ways we can reduce that inflammation? How can we improve the gut flora? And we know that impacts health. How can we improve motility? We know we're dealing with these nervous system differences and the muscle differences and the connective tissue differences. How can all those impact the GI tract's ability to move food and waste through the from top to bottom? How can we improve that? Is there an issue with cognitive health? We know that this bacteria impacts mental health, but can it impact cognitive health? And are there differences that we might impact by doing that? And so there really is this concept of food as medicine that's really gaining a lot of steam. And so really looking at what we eat and how that might impact us in a positive way, and all these things that I just mentioned, but other ways as well. And another term that's really being looked at now is a term called lifestyle medicine. Are there things that we can do in daily life, what we eat, how we exercise, how much we drink, et cetera? How does that impact our overall health and potentially reduce or the possibility or prevent us getting health conditions or health impairments? And so really, one of the things we really want to look at is with this is diets. And I'm not talking about a diet, in the restricting things, but a diet in the sense of healthy nutrition. And really there are some good examples. And there's no one diet that's been, shown to solve all the problems, and everyone is different, and they have different things that work for you. But a couple that are really have been shown to have some benefit. Again, these studies have not been done in people with Down syndrome, but have been done in the rest of the population. Things like the Mediterranean diet, and we'll talk a little bit about some of what that means here in just a second, or the anti-inflammatory diet. So lots of things, and we're in the age of the internet, and there's just so much good information out there about different diets. And we've at the end we've listed some resources that you might look into that really would help you from really kind of help plan meals and really helping with good choices on or better choices, if you will, on eating. And then there are some individuals will benefit from very specific diets. Obviously, those with celiac disease, going gluten-free, and we'll talk about that more next time. And then something called the FODMAP diet, which is really eliminates some sugars and things in the diet that really do help some individuals with the challenges that they're having. And again, none of these are one size fits all. And certainly if you don't have a condition that would potentially benefit from that, or you're finding that diet doesn't help, then certainly we got to keep looking for other possibilities. But what are some good general guidelines on diet? And again, going back to look at Joe, that really might end up helping his constipation as well. So one is, again, none of this is probably going to be stuff you haven't heard, but I think it's stuff we really want to just continue to really encourage for not only for people without Down syndrome, but I think people with Down syndrome really want to go back and take that step back. And as we look at medications and we look at a lot of other things, are there things in our diet that we can really help people with Down syndrome choose foods that are going to help them feel better? And the other thing I would add is there really is some information now coming out. We're not going to really talk about Alzheimer's disease as part of this presentation, but obviously you probably know that Alzheimer's disease is significantly more common in people with Down syndrome. And there's data now coming out looking at diet and all these things we're going to talk about GI health. They may impact Alzheimer's disease and whether it's helps reduce the chance of getting it, whether it delays the chance of getting it, whether makes the symptoms not as severe for longer, whatever. But I think there's more and more information coming out about the many advantages of really looking at our diets. So again, really looking at fruits and vegetables, a diet, these are rich in fiber and the prebiotics. Prebiotics are foods that promote the growth of healthy bacteria in our guts. They're not actually healthy bacteria themselves in the fruits and vegetables, but they do promote the healthy bacteria in our gut. And they also provide antioxidants. And we know that there are certainly some information about people with Down syndrome having more oxidation, which is a form, part of the breakdown of foods and other things. But the formation of antioxidants can have a negative impact on our health. So really, really focusing on making sure we're getting enough fruits and vegetables. And then whole grains, they provide fiber and they're resistant starch, which feed this beneficial bacteria. So really, it's kind of a recurrent theme as you're hearing that this bacteria in the gut really, as we're learning more and more, really can play a very significant role in our overall health. And then fermented foods such as yogurt and sauerkraut and kimchi, these actually contain probiotics, and probiotics are actually the healthy bacteria. And so eating them actually promote the growth of them. As we eat these, they promote the growth of healthy bacteria in our guts. And so really do, hopefully then will then have a real positive impact on our overall health. And then again, nuts and seeds, they contain healthy fats and fiber. There's a lot of, over the last generation or two, there's been so much discussion about fat and the negative implications for eating fat. But we do know that in addition to fats that we probably should avoid, there are healthy fats that we should be consuming, and some of them are in nuts and seeds. So those are certainly something we want to include in the diet. So really start looking at these things as almost like you would medicine. I want to make sure I take my pill 1 time, 3 times a day. I want to make sure I'm eating my apple 1 time, 3 times a day, or my whatever, the fruits and vegetables. And so really want to try to include this in our healthy approach to our lifestyle. And then lean protein as much, we can certainly get it in plant sources. There's a lot of available protein in plant sources, but then also things more like chicken or fish and eggs, and really reducing the red meat and the foods that tend to be higher in fat. And these are so again. We want to make sure we're getting good health protein in the diet because they're essential for gut repair and immune function. So very important as we're looking to promote the health of the GI tract to make sure we're getting some lean protein. And then again, I mentioned the prebiotic foods, and here's some of the ones that you would particularly, in addition to fruits and vegetables, well, some of these aren't fruits and vegetables, but onions, garlic, asparagus, and bananas would be particular foods we'd want to look at. And then hydrate adequately, drink plenty of water throughout the day. And we're going to talk more about that in a little bit here, but it really, overhydrating is not necessary. So overhydrating probably doesn't get us more benefit. There's probably a curve where, making sure we're getting at least, 30, 40, maybe 50 ounces a day of water or fluids. But, drinking 500 is really probably not going to give us any better health. In fact, it has potential for negative health implications. So, but certainly getting an adequate amount of fluid is very important. Oh, and I should mention that yogurt is again a great source of protein and a source of probiotics, but a lot of yogurt has a lot of added sugar, and that really is, as you'll see in the next slide, that's not what we want to be doing. And so really yogurt with limited added sugar is important. So what are those foods that we should limit? Certainly, again, looking at the processed foods and they're high in unhealthy fats and sugar and additives. And again, there's been so much discussion about these issues in the non-Down syndrome population. And again, these are not well studied in people with Down syndrome. But really, there's no reason to suspect that this is going to be not a good thing for people with Down syndrome as well. And there are so many potential implications for this, not only on the short term, but on the long term as well. So we really want to, again, kind of go back and take a look at how people are eating. Sugary drinks, again, they can disrupt the balance of the bacteria in the gut. I have talked to many, many people with Down syndrome and how much so many of them love soda, just like the rest of us. But again, really kind of taking a look at that and are there other things we can replace for those sugary drinks that are going to have improved gut health rather than a negative impact on the gut health. Refined carbohydrates like white bread, pasta, and rice. Again, these can all contribute to inflammation. And again, as I mentioned, we know that inflammation is more of a problem in people with Down syndrome than in other people to start with. So can we have an impact by really focusing on what we're eating or what we're not eating to reduce that inflammation, which has a number of implications for health, which we won't go into right now. But again, those can avoiding those can help reduce the inflammation. Certainly, excessive alcohol can be a problem. It can damage gut lining, interfere with the gut bacteria. And so really, alcohol limit. And this really, when we opened the clinic 33 years ago, this really was not a much of an issue. But as people have become more independent and been more involved in society, which is all a good thing, sometimes they also get more involved in the alcohol consumption, and that again has some real negative implications for people with Down syndrome as it does the rest of us. And then again, the red meat issue, overconsumption of red meat can be detrimental to gut health in a lot of ways. So really kind of looking at those and trying to promote, again, trying to promote this concept of food as medicine is real important. And again, some other considerations. We talk about foods with probiotics. Certainly there are probiotic supplements, and there's a whole host of them. And as we'll talk about next time with constipation, the data really just is not out there yet to demonstrate their benefit, but it does seem to make sense that if you can't get it through food, that probiotic supplements might be beneficial. The problem with studying it is that there are so many variations with so much difference of the amount of the bacteria and then which bacteria in the supplements, et cetera, et cetera. So it's not an easy thing to study, but hopefully more information will be coming as time goes on. And then, I'd say that for some individuals, I should say that, they clearly feel better when they're taking a probiotic, and other people actually don't feel any better. In fact, some people feel worse when they're taking a probiotic. So really, it's an individual thing and something you want to, if you do decide to use that, to kind of monitor that and see, is there a benefit or is there not, or in fact, is there a detriment? And so that's something we want to take a look at. Exercise, again, many reasons people should exercise, and clearly for people with Down syndrome as well. And the studies do show that individuals with Down syndrome typically don't exercise as much as others, and very frequently don't meet guidelines for weekly exercise goals. And so really want to aim for 30 minutes 5 times a week. And again, it doesn't have to be you don't have to go out run 10 miles every day or anything, but just getting out, be active. There's data in the non-Down syndrome population about the benefits of exercising outdoors and in nature, and so that certainly would be a consideration as well. And it doesn't have to be all 30 minutes straight. So three sessions of 10 minutes are also very helpful. And some people have a hard time, some people with Down syndrome have a hard time doing 30 minutes of sustained exercise. So again, that would be a good place to, we're going to do 3 times a day for 10 minutes. And walking is a wonderful exercise, but, whatever the person enjoys, I think is in many things in medicine, the right one to to do is the one that you'll do or the one you'll take. And so we really want to encourage people to look at what they enjoy doing. And this may change with time. I often hear, well, he doesn't like to exercise anymore, but the only thing being offered to him is the same thing he did when he was 15 and now he's 40. The rest of us, as we go through life, will change the things that we're interested in, whether that's because of health issues or our capabilities, or just our personal preference. And so, really to help people explore what it is that they would like to do. But keep active. And we do know that certainly from a social standpoint, doing it with others for many people is really helps promote exercise. And so doing it as a family or doing it with others is certainly one of the ways to promote exercise be done more regularly. And then the other thing that really has an impact on GI health is are the eating habits. And we do see that these are common issues in people with Down syndrome that we run across in our office. And so many people with Down syndrome, as many people without Down syndrome, eat too rapidly. And so eating more slowly is important. So, and chewing well. So, the digestive system is really designed for food to be chewed well into small pieces in our mouths, and then to go through the system to digest these smaller pieces appropriately. But if large unchewed pieces end up moving down the chain down into the intestines, the body is just not able to break those down as well. And so that has implications with regards to, really getting the advantage of the vitamins and minerals, et cetera, in those foods. But also, undigested food is not comfortable, that we don't feel as well, and can contribute to other health issues. So eating more slowly and chewing well. And this is a topic that we talk about a lot in our office with a lot of individuals. And so we call that the healthy pace for eating. And this is available on our website. We have some visuals there that you can see in the top picture. And then we actually have a video where Julia talks about eating at a slower rate to make sure that you're not eating too fast, that you're chewing well, and also avoiding choking as well. So one of the things in the video, Julia talks about putting utensils down between bites and taking a sip of fluid between bites. And so a number of things that are pretty easy to do. And the video really is a nice way to promote these I'll call them behaviors, the eating habits, for people with Down syndrome to watch the video and then to hopefully replicate it in their own eating habits. So a number of things that we can do and people with Down syndrome can do to really promote their GI health. And again, as we learn more about the GI system, the gastrointestinal system, and the bacteria and the microbiome, we do know that this can affect a lot of other parts of our health. Again, our mood, or even potentially our cognition, our thinking, et cetera, and has the implications for many, many health conditions. So really trying to look at, take a step back. Let's look at what we're eating. Let's take a look at how we're exercising, and really try to see what we can do to optimize our health. And then whether we do all those health promotion things or not, sometimes we will develop some gastrointestinal symptoms. And so let's talk a little bit about that. And this is really in preparation for part 2, which we'll talk more about specific gastrointestinal conditions and the specific symptoms. But this is just sort of a broad overview of some of the gastrointestinal symptoms that we commonly hear about. So certainly pain is one of them, and that can be from all sorts of different things, from dental pain to ulcers to heartburn to constipation. Many, many things can present with pain. And we do know that pain in general in people with Down syndrome can be tricky. For years, it was thought that people with Down syndrome don't experience pain or don't experience pain as much. In fact, the studies would suggest actually the opposite is true, that many people with Down syndrome actually experience more pain than others. But what happens is that they may have difficulty reporting that pain. And that may be, some of it may be a verbal communication issue. Some of that may be a cognitive issue, that they have difficulty verbalizing what they're experiencing. Some of that may be that people with Down syndrome seem to have more difficulty localizing their pain. And so, pain that is coming from gastrointestinal area, they may not be able to point to that, or maybe not be able to say that that's where it's coming from. May have a difficult time explaining where the pain is coming from, which makes it difficult to understand. And then also from pain, it seems that people with Down syndrome may have a delayed response to pain. And again, so not that they're not experiencing it, but that they may have difficulty reporting it, or may be delayed, and so it may be confusing to those of us that are trying to sort that out. So certainly pain is a common symptom, although it can be challenging to sort out. Certainly change in bowel movements is a very common thing, and we'll talk a lot about constipation next time. But it may be related to dizziness and fainting. We talked about the autonomic nervous system and how it is part of the gastrointestinal system, but also affects heart rate and blood pressure. And so if that part of the autonomic nervous system is getting, in a sense, overly triggered by something going on in the gastrointestinal tract, sometimes that signal will go up and will work its way through the autonomic nervous system and then affect heart rate and blood pressure. And so we see some people, we've had a number of people that presented with gastrointestinal symptoms by fainting. And as you sorted it out, it was whether it's pain or other dysfunction in the autonomic nervous system coming from the GI tract, ultimately affecting the heart rate and the blood pressure. So really going to have to sort through all those issues. Certainly nausea and vomiting, bloating. Some people just feel weak. Some people have a change in sleep, particularly with things like heartburn or reflux. It may be causing them discomfort at night, and they may not be able to tell us that that's what they're having, but we notice that they're not sleeping as well. So that would be something to consider. And certainly weight loss, like anybody else, if we have a gastrointestinal problem, we may not be eating as well. We may not be absorbing the food as well. We may not be absorbing certain vitamins and minerals as well. So there may be all sorts of reasons why people are losing weight. And so certainly weight loss is a real flag that we need to go looking. And again, other symptoms include neurological or other symptoms due to vitamin deficiencies. I mentioned the B12 deficiency issue that can be caused by a number of issues in people with any of us, but particularly in people with Down syndrome, because they seem to be more common. And those vitamin deficiencies could have significant impact on the neurological system. So it may be presenting, an imbalance in the gait that's related to a vitamin deficiency that goes back to the gastrointestinal system. So again, you got to kind of piece it together as to what how these causes are related. And then there are a number of symptoms that are non-gastrointestinal. So all those are sort of gastrointestinal symptoms. And so a number of individuals that we see might present with a mood change. Again, they may not be able to explain their symptoms. They may have a hard time localizing the symptoms. And I always say that gastrointestinal complaints, for the physician or the health professional to understand them, a good history is so important. Where exactly in the abdominal area is the pain? What brings it on? What makes it go away? What does it feel like? Does it come and go? Is it all the time? Is it associated with this or associated with that? And all those are important questions, and all that's important history. And again, unfortunately, some individuals with Down syndrome are not able to report those things. And so, like any of us, if we're having discomfort, and particularly if we're not able to report it, we may have a change in our mood, or it may make us anxious. And so we like to say that any and all behavioral change should be considered as a possible form of communication. So is the person with these changes in their mental health, if you will, is this really a symptom of a gastrointestinal problem that's going on, that we're not otherwise able to get the history from the individual? Is the person getting upset or frustrated more easily? We're going to talk about gallbladder disease next time, and which is more common in people with Down syndrome. And we've seen a number of folks with Down syndrome that we think we're having trouble with their gallbladder that they weren't able to tell us, and it ended up being that they were getting upset or agitated or angry at times. And we think maybe that was related to the discomfort they were having. It may be difficulty concentrating. Certainly any of us, if we're not feeling well, can have difficulty concentrating. And that's true for people with Down syndrome as well. And again, just like the neurological changes related to vitamin deficiencies and mineral deficiencies, we know that can impact mood and mental health as well. So all those are important things to consider. And so really, when people present with these psychological or these changes, really important to think of potentially of the GI tract. And again, what is the direct effect of having, I think we don't know as much about to this answer, but what is the direct effect of having these differences in the bacteria in our gut, the healthy bacteria, and what is the impact on our mental health? And so it's becoming more and more clear that it does have an impact. I think we're still learning, particularly in all of us, but particularly in people with Down syndrome, what the implications for that are. And then lastly, before some time for questions, I want to talk about just real quick about some gastrointestinal testing. And as a family physician, I'm a family physician by training, and I did general family medicine for a number of years before working in the clinic. And I always say that I frequently say that in people with Down syndrome, we end up doing more gastrointestinal testing, again, because we don't always get that history, as I mentioned before. So really to sort out potentially what's going on in the GI system without that real precise history, we may have to do a little more testing. And at least in my experience, that's true for my interaction with people with Down syndrome. So gastrointestinal testing may include certain blood tests, a number of imaging studies from a video swallow study to look at swallowing issues. There may be x-rays, there may be just a plain x-ray of the abdomen looking for constipation, or a CAT scan looking for, why is this person having pain? It might be an MRI, but even a more specific MRI is looking at gallbladder. There may be nuclear medicine scans looking at how does the stomach empty? Is the person having trouble emptying their stomach? Contrast or dye may be added to some of these imaging studies, depending on the reason for the test. So if you're looking for one thing, particularly focusing on one thing, you may not need the contrast, but if you're looking for something else, you may need the contrast. And so that may be part of the testing. And then the other question is, does the person need sedation or anesthesia? For some of these tests are can be challenging for any of us, but for some people with Down syndrome, they can be very challenging. So perhaps they need to be arranged with an anesthesiologist even, or sedation to help the individual be able to successfully complete the test. And then there's a number of scopes that can be done. A laryngoscope looking more up the upper airway. Is there something there contributing to causing swallowing dysfunction, for example? Or an upper endoscopy, or often called an EGD, where you're looking at the esophagus and the stomach and the first part of the small intestine. Is there something going on in there that's contributing to whether it be swallowing problems or pain or weight loss, whatever the case may be, or anemia? So a number of reasons that an upper endoscopy or an EGD may be done. And again, that one typically has to be done certainly with some sedation and in some folks, general anesthesia to successfully complete. And then lastly would be a colonoscopy. And this can be challenging because to really do a good colonoscopy, you have to do a clean out, if you will, and take medications to reduce or eliminate the stool in the colon, and that can be difficult for some individuals with Down syndrome. But many of our patients have successfully undergone colonoscopy preps and then successfully had a colonoscopy. Again, typically done with at least some sedation, if not general anesthesia. And we have some information on our webpage, and for example, the visual there is getting a swallow study. It kind of walks people through what to expect with some of this testing that can help. These social stories can really help people prepare for the testing and allow them to have a better understanding of what's going to happen. And with that better understanding, hopefully will come an ability to participate more in the study and do what's needed to make that test be done successfully. So what are some takeaways from today? There are differences in the gastrointestinal systems of people with Down syndrome compared to those without Down syndrome. There are a variety of lifestyle changes that can be made that have or may have significant benefit for the health of people with Down syndrome, and then the diet and exercise, hydration, and eating habits. And I cannot overemphasize the importance of really kind of taking a look at these things and what can we do to really help people with Down syndrome take control of their own health and feel better and reduce the chance of having health complications. GI conditions can present with a variety of gastrointestinal and non-gastrointestinal symptoms. So even though a person may not be complaining of abdominal pain or may not have diarrhea or constipation or vomiting or any of those, they may still have a gastrointestinal symptoms or a gastrointestinal condition if they're having some of these other symptoms. And so certainly something we want to be considering. And then there are many diagnostic tests available to assess these GI symptoms to try to help us sort this out. We have a number of, you'll be getting copies of the slides. We have a number of articles on our webpage, and we're in the process of updating many of them right now. I mean, not right now, but in these recent weeks as we're prepared for this today and next time. So lots of good information about the gastrointestinal system on our webpage. We have a number of videos and visuals that hopefully can help with healthy eating, and again with a focus of encouraging people with Down syndrome to use these videos as part of their promoting their own health, And again, as people with Down syndrome have had more opportunities to become more independent and participate more in society over time, we really want to give them the tools that they can be successful with these opportunities out in the community, making healthy choices and doing the things that they really need to do to promote their own health. Our mental wellness book is available. Those of you that know about the book, we published a second edition, I don't know, 3 or 4 years ago, 2, 3 years ago. And unfortunately, Woodbine House, the publisher, went out of business shortly thereafter. Hopefully not because of our book, but because of the reality of publishing these days. And so after looking at different options, we decided to make the book available free on our webpage as a PDF. And with the generosity of the Matthew Foundation out of the San Francisco Bay Area and an organization in Spain, we were able to also provide it in Spanish. So both of those are available for free on our website as a PDF. If your healthcare professional you'd like your healthcare professional to know more about taking care of people with Down syndrome, I would encourage you to share the Down syndrome medical interest group with them. There's a number of things that we provide through DSMIG, including Project Echo, which is where a health professional can present a case anonymously, so the individual with Down syndrome is not shared with the group. And then there's a panel of Down syndrome experts on the Zoom meetings, and then they share recommendations with the health professional. So if your loved one with Down syndrome is having some health challenges that you think your health professional would benefit from that, please feel free to have them reach out to us through the link there. There's a number of webinars for health professionals, and some of those non-professionals appreciate as well. And in fact, there's one coming up on medications for obesity, which I think there's a lot of interest in, and so that'll be available. If you go to the website, you can see the information about that. And there's a number of resources. And then again, for health professionals, there's membership opportunities. And I would say it's the least expensive professional organization I belong to by a long shot. So it's a very relatively low cost membership. And again, if you're looking for more information, either for the health professional or for yourself, this summer in Dallas, the Down Syndrome Medical Interest Group we're having our annual symposium for health professionals, and it's linked to the National Down Syndrome Congress Convention, which follows right after the DSMIG conference. And so a lot of good information. If you've not been to a NDSC conference, there are really lots of good information and lots of opportunity to interact with health professionals as well as families and other people with Down syndrome. So really, really wonderful opportunity. And then we have a number of primary references listed here. And we're going to stop for questions. Before we get to the questions, just real quick, if you'd like to support our mission, feel welcome to do that. And we're going to jump back to questions.
Thank you, Dr. Chicoine. We've gotten quite a few, so I'm going to dive right in and we'll go a couple minutes over. And if we don't get to all of them, please check out our resource library. One question was about promoting gastrointestinal health for people with a feeding tube. Are there differences, similarities?
So with a feeding tube, I think you really want to go back to the dietitian that and really go back, what are the ways that we can make sure we're optimizing the fiber in whatever that we're, putting in the tube. Make sure we're getting the vitamins and minerals. Make sure we're getting the right amount of calories, making sure we're getting the right amount of fluids. So I think it's I mean, it's even more challenging than it is with, you know, it's challenging enough with the availability of less than healthy choices in the American diet, but certainly the limits of what you can put in a tube is very important to make sure we really are understanding that all those bases are being covered, and that really the best place to get that is from a dietitian.
Thank you. Um, would you mind talking about the GI symptoms of chronic burping and or chronic gas?
Yeah, we'll talk more about reflux and some other things, ulcers and things next time, which will certainly can be those can be some of the symptoms of. But I think for a lot of our individuals we see, we talked about the rate of eating, and so there's something called aerophagia, which means air hunger. And so people that are eating very rapidly will often swallow air. And so that can really contribute to burping and bloating and other things. So really, one of the things we really talk about is with when those symptoms. I mean, there are a lot of other reasons for having those, and we'll talk more about those next time. But really, some of a very common reason for that is eating too fast. And so, if you can help people slow down and chew well, and again, I talked about food that's not, again, a large piece of steak is not supposed to be sitting in the small intestine. I mean, we're just not designed for that. And so, when that large piece of steak gets to the small intestine, um, you know, that's just going to be digested in a different way, and more gas tends to be a common symptom. And then again, certainly looking at the diet, and are there certainly, and there's lots of information online about more gas producing foods, and you might want to take a look at that and see, is it something that in the diet that may be contributing. Again, a lot of the processed carbs can be digested differently or not well digested, and so really looking at those as well. So there's a number. I think really focusing on just the general guidelines for a good nutrition, a good GI health that we talked about, could have a real impact on those symptoms.
Thank you. Um, Drinking water is a struggle for this individual. Is diluted apple juice better than nothing?
Yeah, so we have a number of resources on water alternatives. Um, in my experience, not unlike many of us, but in my experience, many people with Down syndrome are water averse to drinking water, and so they'd rather drink something else. And I understand that, and a lot of people have that same issue. So really looking at alternatives, and so yes, I would say, particularly looking at more natural apple juice, if you're going to use that, something that doesn't have a lot of sugar added, but diluting apple juice, diluting non-sugar added orange juice, um, you know some tea or even coffee for some individuals. And again, diluting it if you're having other negative impacts. But again, really trying not to introduce a lot of sugar and even potentially artificial sweeteners, which more and more studies going on that, and what are the potential of some of the implications for that. But yeah, I would say the short answer to your question is yes. I think diluted apple juice in that situation would for most people would be better. But there are some other choices as well, and we have a number of a couple of resources that look at alternatives to water that people will drink.
Just anecdotally, we do a summer wellness group, and last year we had fruit infused water. So you just take a pitcher, put water in it, and then we put strawberries and put it in the fridge overnight. And the participants really enjoyed it. And it was just water with some strawberry in it. And it just gave it enough flavor.
I mean, I get it. I have the same issue personally, and it's really it's not so much a taste issue as it's a sensory issue. And not sure I can really explain that water is so different than diluted apple juice, but somehow in my mouth and brain it is. So I get that issue.
Thank you. Um, Can gut health affect skeletal issues?
Yeah, and we didn't go into all the details, but certainly, absorption, issues of calcium absorption and other, you know, magnesium and other things that impact both, our bones and our muscles function. Absolutely, if the GI system is not working like it should, there can be some significant impacts on really the whole body, but including the skeletal system and the muscles.
Thank you. Is anyone looking at the microbiome in the Down syndrome population compared with other populations?
Yeah, I think so far what we know that it's different. What the implications are, I think people are still looking at. But again, we talked about. I mean, some of it is lack of knowledge for all of us, much less people with Down syndrome. So again, so what are the implications with mental health? It looks like that's certainly an issue in the non-Down syndrome population. We suspect it is in the Down syndrome population, but more study needs to be done on that. And I think there are people looking at that. Same with cognition, certainly, and the whole issue of Alzheimer's disease. What is the potential implication of the microbiome with regards to our cognitive abilities, but also potentially the development of neurodegenerative conditions like Alzheimer's disease. And certainly people are really looking a lot at inflammation. And I talked about inflammation and the implications with the microbiome with inflammation throughout the body. And then, so what are the implications of that with regards to, Alzheimer's disease, which is more common in people with Down syndrome. And people are, and again, a lot of this is being studied in people without Down syndrome, but also hopefully some people are starting to look at it in people with Down syndrome as well. The whole issue of leaky gut and, are there things that are being absorbed that really shouldn't be absorbed and, should go right on through, and what are the implications for that? So I would say that a lot of study needs to be done, but also a lot of study needs to be done in people without Down syndrome. But it is pretty amazing that, really in the last decade or so, or maybe a little more, how much more information is coming out on this. And as information comes out about the non-Down syndrome population and its benefits, I think, for the most part, we want to probably look at, probably not a bad thing for people with Down syndrome as well until we learn more. But, most of these things seem to be, probably make sense for all of us.
Thank you. Well, we are a few minutes over, and there were quite a few questions about constipation, GERD, celiac disease, and Dr. Chicoine is going to go into much more detail on those in part 2, which is on Thursday, May 29th at the same time, 11 a.m. Central Daylight Time. So if you haven't registered for that one, please make sure you do. And thank you so much for joining us, and hopefully we'll see you in a couple weeks.